Now, the British Dental Association has warned that access to dentists has fallen off a cliff after figures reveal that 6.5 million children have not had a checkup in the last year.
Well, this comes as the Lib Dems call for an emergency rescue plan for NHS dentistry. So let's speak to the founder of this bespoke Smile Advanced Dentistry and Academy, Dr. Sam Jethwa. Good morning to you, Dr.
Morning.
Sam. Always good to have you on the programme with us. So what is happening? Because children get free dental care, don't they, on the NHS? So why aren't they going to their appointments?
Yeah, that's right. So children do get free checkups and even free treatment as well if they need it, up to the age of 18 on the NHS. The problem is access to an NHS dentist. That's one issue. The other issue is everybody needs to know that if they have children, they should try and get them seen by the dentist as soon as there's teeth there. So babies actually should start to go to get familiar with the environment. So it's a couple of things: education, prevention, or whatever we can do to get that going, and then also access. There's a big problem with access.
Is this becoming a generational thing, which you get actually with a lot of cooking and these sort of issues, where it's not just that the parents aren't doing it with the children, the parents themselves don't really know what to do?
Yeah, I think it's one of those things where having a family is like, are you always ready for it? You probably learn as you go along. And one of the things that's important is often parents will say, oh, my child's 3, 4, when do I bring them in? And the answer is, well, as soon as there's some teeth there. Yeah. As soon as you can see some teeth, try and get them some access.
Because the reality is there can be serious health implications, can't there, if you don't look after your teeth?
Yeah, so there are many, many studies that actually show that there's so many different health issues, systemic issues, physical health, that stem from links to gum disease and prevention, things like that. So that's what I want to show you today as well.
Oh, God, I notice you've got a massive set of gnashes on the desk.
They're terrifying.
The biggest thing we can do is prevent things from happening. And as you say, the link between heart disease, infertility issues and poor gum health is really being more and more substantiated by studies. So the more we can do to keep our teeth clean, the less actually health issues we're also going to have as well. And you won't have to have so much treatment and have to join a waiting list possibly as much.
Yeah.
Yeah.
So talk us through, what's all this about?
So we have, you may have heard of metaphorical big mouth, we've got a literal big mouth here. OK? Yes. And that's for you, Stephen.
Oh, thank you very much.
I'll show you that. And I want to just do a little test with you, if that's all right.
Yeah.
You're on the spot now.
Yeah, no, go on.
I'll give you a giant toothbrush.
Oh, wow.
That is giant.
OK.
Now, this is obviously not mimicking a real-life situation because your mouth is much more regular size than this one, and your toothbrush, I'm sure, is more regular.
Well,
But try to, and this is something that we don't often think, how do we brush our teeth?
Right.
Off you go.
Try and think, this is in the morning, 3 a.m. before you're coming into the studio, how are you going to get in and brush your teeth?
So I always start on one side and I sort of go like that.
You go up and down.
Okay.
No, I don't. No, I'm taking it off. So I'm only, so I'm only going down.
You only go down?
I'm only going down.
Very
hey, what would you do
you
differently?
have a go?
Oh, I'm quite aggressive, Sam. You're not quite like me. So I do this.
Ah.
What? Across like that?
Yeah. And then I go like this, and then I do this.
so we've got up and down.
Well, down.
Just down.
Yeah.
And we've got side to side.
Yeah.
Yeah? OK, shall I show you what we should be doing?
Yes.
Yeah.
All right. So the risk with your technique, Ellie, is you're going to have more risk of gum recession.
Oh.
That's when you lose the gum. So side-to-side motion is more likely to cause that. What the risk with your technique, Stephen, is that you're not going to clear the plaque as much as you really want to.
Right.
OK, so the best way to do it is if that's your toothbrush and that's your teeth, the upper teeth, I'd like you to angle your toothbrush upwards.
Oh.
Yeah.
And I'll try and show the camera this. If you hold your toothbrush sideways, the bristles don't get right in between the teeth. But if you angle it upwards, they're actually touching the gum line in between the teeth as well. And then round and round in circles.
Round motion.
A round motion, medium pressure, allow the bristles to do the job, and you'll see it better than possibly the viewers, but the bristles are actually getting underneath, and you go all the way round, and you do that 30 seconds per side, 2 minutes, all the way. Don't forget the backs.
Yeah.
Exactly the same technique. So if it's the lower teeth, you'd angle your brush downwards, and you can see that a little bit more clearly how the bristles are getting right the way in between.